It is a pleasure to be with everyone tonight, and I do want to thank our distinguished guests, and I want to thank the Global Health Workforce Network, the World Health Organization, IntraHealth, and certainly Last Mile Health for your extraordinary partnership. And I want to thank Raj for your leadership in really championing the values and importance of investing in healthcare workers and the role that healthcare workers play in closing the healthcare gap in the world. I also want to acknowledge we had a very extraordinary technical briefing today on investing in the healthcare workforce, and Madam President spoke very eloquently, I thought, about the importance of the healthcare workforce during the Ebola outbreak, but also after. And I am constantly thanking you, though you do not know this, but for championing investing in the healthcare workforce as one of the first initiatives that you launched, and he was incredibly proud to help with that recovery effort when it started. And I think it's important to realize that Ebola didn't just disrupt the healthcare system at the time, it disrupted it for a long time after. And it's estimated that there are more deaths from measles, from the disruption of health services and the loss of the healthcare workforce from the Ebola outbreak in the years after Ebola than actually died from Ebola itself, which isn't to undermine any of the loss. It's to recognize the power of disruption of these diseases when we don't have the ability to care for them in the first place. So that's what this event is about. This event is about not just having a discourse about investing in the healthcare workforce, but it is about really the commitment and action we need to invest in the full continuum of a robust, diverse, and really full, comprehensive healthcare force. Because the healthcare workers are the backbone of the health system. They are the agents of change. They're on the front line of caregiving. And they're a huge return on investment. That data is there. I won't repeat it for you tonight, but it's why Seed Global Health believes in the power of investing in this healthcare workforce with this idea that we focus on healthcare professionals, the belief that they can help with the care delivery, that they can help train their successors, train across the continuum, be problem solvers in partnership with their colleagues and everyone who they work with all across the system. And we know it can work. In northern Uganda, where we, and I believe some of the delegations here tonight in northern Uganda where we've worked, we helped graduate, open the doors of the School of Midwifery and training in an area that's been conflict-ridden for years. The first 2 years of graduates, 74 midwives are working in the north and are employed. We know it can work in Zambia, where Zambia made a huge commitment to train 30,000 healthcare workers and has already filled 20,000 of those positions. In Malawi, where they are committed to comprehensive healthcare from the community health worker to the health professional in order to deliver the promise of UHC. We've heard many, many conversations that have been critically important commitments during the World Health Assembly this week. But whether we're discussing universal healthcare, biosecurity, vaccines, or job creation, healthcare workers are at the center of delivering each and every one of those goals. We've made very powerful interventions in health in the last 30 years, and we've made huge progress. The one thing that we have not invested in consistently or comprehensively enough in all that time is the full and complete healthcare workforce that we need in order to close the two standards of care in the world. We live in an age, a digital age, an age where we keep looking to technology to be the answer, and I ask everybody to not forget that healthcare is a human-centered intervention. You cannot give dignity through a robot or through direct technology. That is the human-centered nature of care that will always be on the front lines. So it is time tonight to move from just discourse, to take the conversation we have now and to make it action. Because as Raj has said, we have never faced a greater crisis. The time is now, the problems are getting bigger, the burdens of disease are now triple. It's not just NCDs and infectious disease, but the new and emerging. So with that, it's my pleasure to introduce Dr. Rupa Das, who is the Executive Director of Women in Global Health, to lead the panel. So thank everyone for joining us.